What is Cathlab?
It's short for
Catheterization laboratory. Is an examination room in a hospital or clinic with a cath lab.
physicians perform minimally invasive tests and procedures
To diagnose and treat, for example, cardiovascular diseases. Diagnostic imaging equipment.
What is the difference between single-plane and biplane cath labs?
Biplane X-ray systems in Cathlab, a specialized cardiac catheterization suite in which transoesophageal echocardiography is performed. The process uses two sets of imaging sources and cameras, each free to move independently, allowing two sets of images to be taken with each injection of radio contrast. Biplane cath lab systems acquire 3D images much faster than single-plane cath labs. That's because they capture image data from detectors on two axes instead of one. However, single-plane systems are also capable of 3D imaging. However, it takes longer for the CArm to move, so the software's reconstruction process can cause a delay. Biplane systems come with 3D software standard, while it must be added to single sharpness.
How to pick the size of a cath lab detector? You should choose the detector size based on the type of work you will perform with the system. The most cath labs with smaller detectors 20 centimeters are preferred for cardiac and pure neurological procedures. 30 centimeters detectors are considered a combo and can perform both cardio and vascular studies.
In flat panel detectors, X-rays pass through the subject being imaged and strike one of the two types of detectors. First, we will look into indirect detectors. Indirect detectors contain a layer of scintillator material, typically either gadolinium oxysulfide or cesium iodide, which converts the X-rays into light. The signals from the photodiodes are amplified and encoded by additional electronics positioned at the edges or behind the sensor array in order to produce an accurate and sensitive digital representation of the X-ray image. The second type of detectors are direct FPDS. Direct conversion imagers utilize photoconductors such as amorphous selenium to capture and convert incident X-ray photons directly into electric charge. X-ray photons incident upon a layer of A-SE generate electron hole pairs via the internal photoelectric effect. A bias voltage applied to the depth of the selenium layer draw the electrons and holes to corresponding electrodes. The generated current is thus proportional to the intensity of the irradiation. Signal is then read out using underlying readout electronics, typically a thin film transistor or TFT array. Automated contrast injectors were first introduced in the cath lab as a way to conserve contrast media in an effort to save money, Newton said. However, using less contrast has now become an important patient safety issue. There is increasing concern over patient contrast dosage during procedures, particularly in patients with renal impairment. The iodine-based imaging agents used in angiography and CT can cause contrast-induced nephropathy, CIN. Automated contrast injection systems help physicians monitor the dosage used. Some systems also allow physicians to set the precise amount of contrast used during each injection. Manual devices in some automated systems do not allow for meticulous control of the flow rate, amount, and peak pressure. Intensifier in cath lab. Image intensifier tubes, or IITs, are optoelectronic devices that allow many devices and medical imaging devices to function. They convert low levels of light from various wavelengths into visible quantities of light at a single wavelength. Image intensifiers convert low levels of light photons into electrons, amplify those electrons, and then convert the electrons back into photons of light. In older cath lab systems, an image intensifier is used, but in newer models, a flat panel detector is the modern cath lab part which replaces the image intensifier. Let's know about CArm X-ray machine work. Mobile fluoroscopic system, also known as portable or mobile CArm, comprises a generator, X-ray source, and an image intensifier or flat panel detector. The C-shaped connecting element allows movement horizontally, vertically, and around the swivel axis so that the X-ray images of the patient are produced from almost any angle. The generator emits X-rays that penetrate the patient's body. The image intensifier or detector converts the X-rays into a visible image displayed on the CArm monitor. The physician can check anatomical details such as bones and the position of implants and instruments at any time. That was the end of the Cathlab series videos. If you liked the video, do subscribe to the channel and give us a thumbs up so we can bring you more topics to learn about biomedical instruments.